Okay, we'll talk a little bit on the anatomy and some physiology of esophagus and the stomach, because when we talk about the stomach, we cannot talk about stomach separately from the esophagus. So let's say, okay, let's look at the esophagus. Why does the stomach and the esophagus dysfunction can cause neck pain and shoulder pain? It's because of the anatomy layout of the esophagus. So the esophagus starts from the C6, yeah, at the cricoid cartilage here, the level C6, and from C6 to T4, they are very, very closely attached to the spine. So anything that happens to the esophagus can cause restrictions in the spinal cord, cervical spine, and also cervical joints, and also the T4. All right. So after the T4, this is the junctions where you have left and right bronchus, and also the aorta comes out from the heart. So this is a junction where there's a lot of structures. So from here, the esophagus will slowly peel off from the spine and travel slightly left. So this is my left, but in the screen, it might look at the right side. So they'll travel to the left side of the thorax and go through the diaphragm, at about T10 level, T10 to 11, to enter the abdomen. So in the thorax, they will have some fiber that exchange with the left lung and the cardiac, the heart that's very closely attached, or there's some fiber exchange with the esophagus before the esophagus goes into the abdomen and join the stomach body. Yeah. So and then the stomach body will join with the esophagus, the duodenum, that attach closely to the spine of lumbar L1 to L4. And the cruise of the diaphragm here, the cruise of the diaphragm that goes to the L1 to L4 will also cross the fiber of the cardiac sphincter. All right. So that is why when we have the dysfunction in the stomach and the esophagus spasm, it causes a lot of symptoms along the spine. So from the C5, 6 onwards, all right, up to the thoracic level, T10, where the stomach body is entry, okay, the entry of stomach body, T10, to the L1, 2, 3, 4. It is because of the connections of the stomach body with the diaphragm, the cruise of the diaphragm, yeah, that goes to the spine, And so when we have a dysfunction in the stomach, in the esophagus, it causes a lot of symptoms, not because of they are very closely attached to the spinal cord, and also because of the phrenic nerve that runs from the C3, 4, 5, and they will affect the left shoulder. Only that they affect left shoulder, they will also affect the diaphragm. So because the phrenic nerve, left and right, they go to innervate the diaphragm as a motor nerve before they goes into the stomach. So when the stomach are not guarding properly, they will also cause restrictions of the vagus nerve that runs along the esophagus, left and right of esophagus, the phrenic nerve, the vagus nerve runs anterior and posterior and along the esophagus onto the stomach, and travels further down into the rest of the abdomen organs. So when we have the problem from the stomach, it will cause a lot of other symptoms, not only gastric reflux, indigestion, so bloatedness, belching. It causes a lot of musculoskeletal symptoms. I guess, Alvin, are you still here with me? Okay, good. I just can't see your video. Yes. So I'll after I talk about this anatomy part, I'll let Alvin further elaborate on all sorts of symptoms that you might see in people who has the stomach problem.
Just now we were talking about this acid reflux, and so one of the symptoms besides from acid reflux is actually you have shoulder pain, okay, left shoulder pain, which is quite common when you have this dysfunction on the stomach, and you also have this some tenderness on your left ribs, okay, heartburn, pain in the stomach, okay. Besides that, you also have this bloating, so you feel like it's feel very full after you eat for maybe 10 minutes, then you feel a bit full. Yeah, so it's everything coming from the stomach. And then next is hiatal hernia, where there's actually an opening of this of the stomach, okay, that is causing the acid to come back up to your esophagus. So yeah, so it will actually cause the heart burning and also the nausea kind of feelings, because there is actually a pulling, okay, a pulling of your stomach going back up. So yeah, so it'll cause the heartburn, you know. So because of that, these are quite common symptoms that we may have. And also we have to remember that sometimes the neck pain and also kyphosis, okay, we have to talk about this kyphosis, the posture which may actually cause this problem as well. So when there's a pulling of your stomach, you may also have this spasm, okay, where
A lot of people they comes to me, they always mention gastric reflux. They will blame everything to gastric reflux. But in my experience, that not everyone has gastric reflux. The real symptom of gastric reflux has to like combine with a little bit of herniations, like hiatal herniations, and tight cardiac sphincter, dysfunction cardiac sphincter, where they cannot control the reflux of the acid. Uh, a lot of people they come with a pure immotility, so that the stomach are not gliding, or the stomach has lost the motility, like what I explained, like in the liver are not moving, they are not functioning. So when the stomach are not functioning, they are not grinding the food, all right, they are not secreting enough the we call it HCI, the acid, the gastric acid to digest the food, so they become like bloated, right? So a lot of symptoms, they all clients say that it's gastric reflux, but to me, I will assess it differently. I will say, okay, now maybe your symptom, you tell me the symptom is gastric reflux, but it's actually no. And gastric reflux has several very obvious symptoms, which is a dry cough, especially at night, huh? And you can't lie flat. Once you lie flat, you feel like you are coughing a lot, and you have this burning sensation in your thoracic near the heart, we call it heartburn, okay, and then you will feel that the throat also feel like burning. You have a belching and with some acidic taste, and some people even feel that they have a tinnitus, because when you have a very bad gastric reflux, you go up to the trachea, you'll go up here, and they will cause some burning to the nerve around the throat. One of the most sensitive one is usually the greater auditory nerve that goes up to the left ear. So I have ask you client who has tinnitus, check with them whether they have a history of gastric reflux. Usually they do. There are other symptoms like immotility, indigestion, which is cause bloatedness, and also we call it a lot of air. There are another symptom, we call it gastrictosis. Gastrictosis is that the stomach body becomes so stretched by several other reasons. So like operations in the abdomen area, where there is the scar that forms in the greater omentum, the abdomen scar, they change the pressure in the abdomen, they pull the stomach body down. So when the stomach body are being stretched, they will overstimulate the fiber that will enhance the secretions of gastric acid. So the people will overproduce acid. Like for the stomachtosis, this group of people will have a symptom like what Alvin has mentioned. They get hungry easily, all right, but 10 minutes towards eating, they feel full again. So they cannot eat a lot of food like a normal people, but after a while, they feel very bloated, very full, and they feel very discomfort. And this group of people, they hate sleeping on stomach. They don't have appetite. They have very small appetite, and they don't like belt. They hate wearing belt because the body are so low in the abdomen. When you wear belt, you are squeezing the stomach body. So yeah. So we have a few symptoms, a few different group of stomach problem when we are talking about stomach. So hiatal hernia, ptosis, and also in we call it frozen stomach, where they lost the motility of the stomach totally. Yeah. So Alvin, do you have anything to add on? Yeah. Yeah. the posture will affect the gliding and also the stomach. And also obesity, right? Obesity and people who has poor tone or very high tone, they also will affect the positions of the stomach in the body. And a history of pneumonia and a problem with the, we call it a crurodome, the ligament here will also alter the pressure in the thorax, which will pull up the esophagus and the cardiac sphincter into the thorax. So I think this is the mechanic problem that we might experience in your thorax and abdominal level. And one, yeah, and one more thing, like people who works a lot with bilateral hand overhead. I remember, yes, overhead, like air stewardess, like those mover and all this. I remember Ron Marotti, one of my instructor in this advanced visceral manipulation course. He said he has one client who is a professional rock climber, but he has very, very bad gastric reflux. So what he advised the rock climber is that to stop rock climbing. To stop rock climbing, and the symptom is symptomatic. Reduce really dramatically because you change the pulling. Because when you're doing this, you are pulling the esophagus and you stretch. Yes, and you also stretch the body of the stomach, which will increase the gastric acid productions. I guess we have to talk about the posture as well, right? Not only that, the type of posture, obesity, elderly, like we have 60% of people who are older than 60 years old, they have gastric reflux because of the poor abdomen tone, because of hormonal change, like a pregnant woman, menopausing, the estrogen levels, yes, so high, it will change the cardiac sphincter, the muscles of the cardiac sphincter, they become looser. So these are all the symptoms that you might experience with client. But all in all, we know that through manipulating the stomach, not only that we can help them with the symptom of gastric reflux, we can also release the spinal cord tension, especially on the left side of the neck, very, very tight. A lot of people, they come with the tightness in the left neck. I guess I need to share one case that came to me 2 years ago with a very bad left neck problem. When I check on her, she has no motility at all in the stomach. So I told her, you have a frozen stomach, but she doesn't know what is frozen stomach. I said, okay, then you will know later when I fix your stomach. And so I fixed her for one session. Then 2 weeks later, she came back. She said that, I need to feedback to you, that after you fix my neck, the pain gone. The pain gone forever. For that 2 weeks, she has no pain. What surprised her is that she said that I fought for the entire one whole week. She can't stop farting. And she came to me with that surprisingly, my abdomen, my belly become flat. I thought that it was fat. I was just purely fat. I do a lot of exercise, but the fat doesn't go down. I thought that I just don't. I'm hopeless with all this fat. And after she fought for 1 week, she said that the tummy gone. The tummy gone. Not only that, she told me for the first time in her life, she heard the tummy growling like some water in the stomach. And she said, oh, I actually can hear them moving. For how many years I never hear my stomach moving. And that's how amazing when you can recreate the movement in the stomach. You can also move some like other organs. The stomach can affect the duodenum, can also affect the colon that attach the stomach, especially the left colon. So it will move their bowel. Then they have other side effect, which is really good side effect of visceral manipulation treatment. I think Elvin will have some case study to show. Yeah. Yes, yes. Mm. Talking about the movement, I also need to share one amazing case of me, an elderly who come to me with very bad back pain. She was walking like this, and then she was bending her neck to the left side. And then her main concern when she see me is that I choke on my food, and I don't have stroke. I'm about 70 plus year old. I have very heavy bag, but what concerns me is I choke on my food. All right, so when we do the assessment, okay, it brings me to her colon, all right, the colon that was so tight, huh? It brings her body downward. So when she said that towards the end of the day, she will walk more and more bending to the left side, but she doesn't know why. So I fixed her colon, and after that, I found that she also had tight tensions in the esophagus, right? Tension in the esophagus, which is really, really bad gliding, and also that goes all the way to stomach, attached to the diaphragm, and also go to the level of the hepatic fraction. So we release all these tissues. So and so she went back with like a comment that she can eat properly. Huh? Can you hear me? They cannot hear your voice. Oh, I can hear you. All right. Okay, Bernice, can you hear me? Okay. Can anyone hear me? Like, can you highlight? They can't hear Alvin. Oh, oh, all right. Okay. But we carry on because some of some of the symptoms that what that you say, right? Because okay, okay. At least they can hear me. I just want to continue sharing my case, my elderly who has back pain and also the throat. All right. So this elderly came back a few weeks later to do reassessment, and not only that she said that she can swallow without choking anymore. She also tell me what surprised her is that she has been having a lot of fiber like Visceral to help her go to toilet. So after I fix her colon, after I fix the diaphragm and all the stomach, she said that she can go to toilet smoothly 3 times a day without having to eat a lot of psyllium husk and a lot of fiber. So now she can go out having like a very relaxed that she won't have constipations from the manipulations. This is how we change a person's life. We correct their posture. We remove the pain from the neck and also the back. We also change their bowel movement, which really help, especially in elderly. Uh, Alvin, do you want to go out and I come back again? Go out and come back. Yeah, maybe you just type what you share. Alvin was talking mostly about the organs that barometric movement, like, but they all follow the embryology pattern of migrating. So we have to go to the center and they go back to the away from the center, back to the center. So like the stomach usually glide out and up and come back again. So every organs, even the tube of the esophagus, they have this motility, down and up. Same with the lung. So we will share this every day with different organs, but the stomach body have to grind. It just have to grind. So without all this intrinsic movement, without the ability to we call it slide and glide among the organs, they will lose their optimal functions. So when they lose the optimal functions, not only that your overall wellness and health will be affected, they will also cause some adhesions into on the tissues, and this adhesion will cause the restriction in your spine, you know, in your mobility of the movement, the joints, because they are closely attached to our spinal cord, are closely attached to the muscular area. So we cannot neglect the movement, and also we call it a slide and glide of the organs. So I think Alvin typing what he was talking just now. So after we talk about the physiology and also the symptoms that you might have with the stomach, we'll talk briefly about indication for visceral manipulation treatment. So who should see us for this treatment? Anyone who suffer from chronic gastric reflux, you know, bloatedness, belching. Okay, if you used to have a lot of medications to suppress this symptom, do see us. We will be able to help you by moving away the adhesions, sliding and gliding the stomach, the esophagus, and also free the adhesions from other organs. Because when you see us for the same symptom, it is not only that the stomach is in trouble. Normally, the stomach are affected by the liver, and it's also affected by the spleen. If you have a car accident history, you may want to see us, because during the whiplash, the impact of the whiplash will cause the scarring of all these ligaments that attach the stomach to the diaphragm. Liver to the diaphragm, and also liver are closely attached to the stomach. So when the liver lose the motility, lose the movement, they also affect the gliding of the stomach, which will show symptoms in the later on of the days after the whiplash. So people who have a left neck pain, chronic left neck pain, they get no relief from frequent therapy, left shoulder pain, unknown left shoulder pain, or some rib cage pain, when you point at the 7th rib and you have this tenderness in the rib, you can see us, because there is this is where the cardiac sphincter is, the entry of the stomach is, and the entry of the stomach will also attach to the T10, 11. So when you have restrictions in the thoracic spine, T10, 11, and also the lumbar spine, L1, 2, 3, 4. Okay, because of the diaphragm, the crus of diaphragm are attached to the L1, 2, 3, 4. It will affect the mobility of the spine. So when you have all these symptoms, like you do see us. If you need, we will be able to help you with the visceral manipulations, and so teach you some simple exercise, and you'll be free from the restrictions, and you will be able to mobile and carry on with your normal physio exercise or any exercise that you normally do. Because I've seen a lot of yoga Pilates teacher who claims that they can't perform certain movement because there's something that's pulling the spine and restrict the normal movement, which they cannot perform properly. So after the visceral manipulation therapy, you'll be able to like perform the certain move freely out of adhesions, and then without any difficulty. So I don't not want to wait for Alvin at the moment. After the indications, if you don't have any questions, you can drop us a note here, and we will be able to, like Alvin and I will be able to answer your questions here. And as what we said yesterday, if you want us to do online consultations, you can also drop us a note. It's free of charge. We will be able to give you free consultations online. Okay, Alvin?